As the number of coronavirus cases and deaths grow in the United States, President Trump phoned into his favorite channel and said this about the latest estimate of the novel coronavirus fatality rate, 3.4%.
I think the 3.4% is really a false number. Now, this is just my hunch, but based on a lot of conversations with a lot of people that do this, because a lot of people will have this, and it's very mild. They'll get better very rapidly. They don't even see a doctor. They don't even call a doctor. Personally, I would say the number is way under 1%.
President Trump, who frequently questions the scientific and medical communities, says he's going off his hunch in his message to the American people. That 3.4% figure comes from the Director General of the World Health Organization, who said this week, quote, globally, about 3.4% of reported coronavirus cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected, unquote. Now, some medical experts caution that 3.4% is a ratio of deaths divided by confirmed cases of the virus. Confirmed. So it does not include the unconfirmed cases, asymptomatic people, or those who have mild symptoms. If you include them, then of course the fatality rate would be lower. And it may be that that's what the president was trying to communicate, but it's hard to argue that if that's what he was trying to say, he did so in a clear and understandable way with all the talk of hunches and his personal view. Instead, the president added to the confusion. Speaking of which, the president took to Twitter today to complain that a different comment he made about the crisis was being misrepresented. Quote, I never said people that are feeling sick should go to work, he tweeted. This is just more fake news and disinformation, unquote. This is what President Trump actually said.
We have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better.
So it is true that the president never said people who are feeling sick should go to work. He also did not say that they should stay home, which is what experts say they should do. Stay at home. Don't go to work. But that was not conveyed in those comments or in the follow-up tweet, all of which was bereft of expertise, short on clarity, long on confusion. In other words, the exact opposite of what a public health crisis calls for, particularly as the coronavirus is spreading across the nation with more than 200 confirmed cases in at least 17 states, as CNN's Nick Watt now reports.
In Washington state, now 70 cases, 11 deaths, 7 tied to this nursing home. Quarantine centers being prepped to contain the spread, this motel and a Department of Corrections site.
I'm very confident that that is a safe facility. It is geographically remote.
Also, now blanket advice for everyone.
We think people should give serious consideration about whether they go to non-essential congregations of people.
Amazon now telling Seattle area employees to work from home through the end of this month. In New York State, the case count doubled overnight from 11 to 22.
8 of the new cases are connected to the attorney from Westchester, the New Rochelle area. 2 are in New York City, and 1 is on Long Island.
Meanwhile, Nevada and Tennessee reporting their first cases.
The patient is an adult male in Middle Tennessee with a recent history of out-of-state travel.
Monday morning, there were 89 known cases across 10 states. Now we're at 205 in 17 states. Is that number even close to accurate?
I think we're seeing the tip of the iceberg with the people who are sick and coming forward. And until we define the bottom of that iceberg, we really can't say.
Yesterday, a California man died. He took a cruise aboard the Grand Princess last month. That ship now held off the California coast. Nearly 3,500 on board, some showing symptoms.
Spirits on board are starting to get quite low.
Coronavirus test kits were choppered out to the ship.
The majority of people on board are over 70. So there's a lot of concern there because a lot of them, they suffer with ill health anyway.
So this is like the angel of death for older individuals.
Now, since we made that graphic saying 205 cases, we've had 10 more confirmed. So we're now at 215. Jake, That is how quickly this number is ticking up. Now, right now, there are no plans for restrictions on domestic travel within the US, but many airlines are reporting demand for tickets is way down, so it seems that some of us, at least, are imposing travel restrictions upon ourselves. Jake.
All right, Nick Watt in California, thanks so much. Joining me now is CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, there are now hundreds of confirmed cases of coronavirus across more than a dozen states. At least 12 people have died in the United States. There's now this cruise ship being held off the California coast to test passengers for the virus. Is this what you expected? Is it worse than you expected?
I think that public health officials have known for some time this was going to start spreading in the United States. I mean, there was plenty of evidence from other countries around the world. So it does fall in line with what we've expected. I think the fact that we have not tested, Jake, we've talked about this a lot, that this testing has not been done as robustly as other places, we still don't have clear vision on exactly how widespread this is in the United States. But what we've seen so far does fit the pattern.
The Assistant Secretary of Health and Human Services said today that because there is not a vaccine or sufficient testing kits in the United States, quote, quite frankly, right now, the only thing we really have is kind of 18th century public health. 18th century public health? Do you agree with that?
I certainly don't want to disagree with the Assistant Secretary. Look, I think we don't have those things, of course, as he mentioned, but we have hospitals, intensive care units, ventilator machines. We have, sometimes people will develop secondary bacterial infections. We have certain types of antibiotics. I do think, to be fair, I think we're better equipped even without a vaccine or some of these therapeutics. In the 18th century, they didn't have these things. A lot of times we compare what's happening now to that time frame. To be fair, we are in a better position, I think, than we were then.
All right. I guess that's some small measure of comfort. We're better off than we were in the 1700s.
Yeah.
Sanjay, Vice President Pence today acknowledged that there are not enough coronavirus tests, and there seems to be confusion because the head of the FDA said 1 million tests will be available by the end of the week. Can you help us understand this discrepancy?
I spent some time with the Vice President yesterday at the White House and really, sort of drilled down on this issue in his office. And this idea that these tests are still being sent out, that is true. This idea that state hospitals and university hospitals may ultimately get FDA clearance to do these tests, aside from these kits that are being sent out, that is true. And even commercial labs like Quest, for example. The problem is, Jake, none of this is really available now. And so maybe it's going to start ramping up by the end of this week, which is tomorrow. But I'm still getting calls from my friends who are physicians saying, hey, look, we know we're allowed to test now, which is great, but we don't have the tests. So for practically speaking, it's not really translating into something for patients out there.
President Trump has been saying things last night over the last few days about the coronavirus that are either false, just abjectly false, or confusing. I know you don't like to intrude in politics. As a medical professional, how concerning is that for you? Is it making your life more difficult?
I think it's challenging because, you want to just continue to represent what we do know, the data, as opposed to trying to play catch up on a regular basis. What I would say, Jake, is that we focus a lot on numbers in the beginning of a story like this. Numbers of infected, numbers who've died, the fatality ratio. The reality is we all know these numbers are going to change. They're going to change as we get more data. So I don't know that we should get that caught up in it. There's a couple things we do know. This pathogen is serious. It appears more serious than the flu, and the flu is serious. The other thing, and I mean this in terms of looking at the population of people, we know who the vulnerable populations are. The elderly, for example. I think it's not so important that 80% are not going to get any illness. That's good to know, but that also means that, 15, 20% are going to be vulnerable. We need to be focused on that. I think some good action was taken this week towards really targeting nursing homes, targeting where vulnerable people are to try and protect them now. We know that. That's true. It's not going to change. So, that's something actionable, I think, that we should be focused on.
Let me just ask, because everyone probably wants to know this, what does it feel like to have the coronavirus? I know you said you're feeling great now. What was the first symptom? What was the worst? What does it compare to exactly?
Yeah, the common denominator seems to be a spike, a very high fever in a very quick amount of time. We had been sent back from the Diamond Princess over to the States on a 747 cargo plane. When I got on the plane, I fell asleep. I was still feeling fine when we got on the plane. Fell asleep next to my wife. 2 hours later, I woke up, and I had a high fever, 103 plus. My wife looked at me and said, "You're flush. I think you've got it." I went back to the doctor on board the plane. He tested me and saw that I did have the fever, was put in a quarantine area, flown here to Omaha, and put in the biocontainment center where I was, again, tested for the actual virus, and it came out positive. But it felt less than a common cold. I didn't have a stuffy nose, didn't have a sore throat, the fever was high, but no body aches, no chills, no sweating that usually comes with 103 fever.
Yeah.
And after about 8 or 9 hours, the fever was gone.
Dr. Rupp, it's Sanjay Gupta. I first met you when you were actually, the University of Nebraska was taking care of Ebola patients back 6 years ago. Can you just give us a sense of how the patients are doing over there in Nebraska? How we hear from Carl, but how sick have some of these patients become?
Yeah, well, we're very pleased to serve as a national resource in this time of need. And much of the experience is exactly as was just related. This is a virus that can cause serious illness, but in most people it's relatively mild. Fevers, cough, and then unfortunately if it progresses to worsening lower respiratory tract infection, pneumonia, and in its worst instances, death. That seems to be more prevalent in older folks and those with underlying diseases. But again, the majority of folks do tend to do fine, and we're very pleased that with these 15 people that we've taken care of recently, that actually we've had 7 of them restored to health and have been released home. We still have 8 of them here in either our quarantine unit or in the biocontainment unit.